Hi, I'm Dr. Greg Castello, board certified family practice, and we're going to do a video in the car tonight on the way home. So I want to talk about the end of the world, perhaps, and how trial attorneys are killing the medical industry, medical profession. So there's been lots of excellent drugs over the last several years that have been literally crushed off of the market because of lawsuits or fear of lawsuits. Antibiotics is a good example. There's been a couple of great oral antibiotics. In fact, the most two recent antibiotics we've had, Ketek and Tequin, oral antibiotics, have both been sued out of existence, and it's been a very long time since we've actually had a new oral antibiotic. There's a few IV antibiotics in the hospital that are relatively new, but the pharmaceutical companies are not actually putting any effort into antibiotics, especially oral antibiotics, partially because of the litigation atmosphere that's out there. So what happens is that bacteria get smarter and smarter every year, and in the past we've had smarter and smarter antibiotics that have been able to outsmart the bacteria, but we're now seeing multi-drug resistant bacteria that literally there are no antibiotics for, and people will die. If there is a bacteria that is IV and oral resistant and we don't have an antibiotic, that could be the end of the world or something close to it, a pandemic or epidemic like we talk about flu infection killing millions of people. Bacterial infection surely could do the same thing. Other examples of great drugs that have been taken off the market are two anti-inflammatories called Vioxx and Bextra. Now these are what are called COX-2 inhibitors. They are like ibuprofen except they're once a day, and they have a much lesser risk of GI or stomach bleeding as a consequence. And ironically, some 17,000 people a year die of bleeding ulcers, and over 100,000 people a year are hospitalized from bleeding ulcers from ibuprofen type of medications. So these drugs came out. There was perhaps some concern over heart attack risk with the medications, and the makers of Vioxx, Merck, got sued to the tune of $1 billion, and that drug is now gone, which is terrible because I have several of my own patients who have arthritis who their life was given back to them by this medication, and when this medicine was gone, there was no medications that were safe or available for them to take, and they're now crippled again with arthritis. As the FDA looks at it, if there's a risk of, say, heart attack, theoretically there probably is a risk of heart attack with the medication, and say even 5,000 people a year die of heart attack from the medication. There's 17,000 people that don't die from bleeding ulcers, but that really doesn't matter to the FDA and the trial attorneys. Ibuprofen now, all other anti-inflammatories that are still on the market carry the same risk of heart attack, yet they're still on the market and they weren't sued. And you want to ask the question is, why? Because ibuprofen is not $1 billion drug and nobody prescribed you ibuprofen, so you can't sue yourself for damages. So will all these drugs carry the same potential risk? It's only the $1 billion drugs, the Bextra and the Vioxxes, that are off the market. There's a couple diabetes medications, Avandia and Actos, that were excellent oral medications, and they were taken off the market as well because of the risk of heart attack. And ironically, diabetics die of heart attack, so it's pretty darn hard to say a diabetic who's been overweight and didn't take care of himself and has high blood pressure and high cholesterol and then took a medication and died of a heart attack, that medication caused the heart attack. But these medicines are now also gone. HDL, good cholesterol, there's been a couple of attempts by pharmaceutical companies to make drugs to raise your good cholesterol, which could protect you from heart disease and heart attacks and strokes as well. And the most recent drug had a slight risk of congestive heart failure, and they knew about this. And obviously, if you have a bad heart, you don't take a medication that might cause congestive heart failure. And the FDA literally went to the manufacturer and said, this drug will never see the light of day. And $300 million into research, they pulled the plug, and the drug is gone. Vaccinations are another example of where litigation gets in the way. With the bird flu potential epidemic and the H1N1 swine flu epidemic, the government asked the vaccine manufacturers if they could produce a vaccine against these viruses on short notice. Vaccines are fairly tricky. They take quite a bit of research and testing to be proven to be safe before they come to market, and the government basically asks the companies to cut the process in half and get a drug out in 3 or 6 months. And the vaccine manufacturer said, well, that's okay. We'll do that, but you need to help us and protect us from litigation. If there's a problem that we didn't know because we rushed it to market, you have to protect us. And the government literally was not willing to offer any assistance or protection to these vaccine manufacturers and said, you risk your neck, you produce a vaccine to save people, and if it doesn't work out, we'll allow you to get sued, even though we're the ones asking you to get saved. So next time something doesn't go right, next time you want to call an attorney, next time you see an ad on the TV or radio advertising baddrug.com, think twice about what you're doing, because it may be your life or your family member's life that is in jeopardy when a drug that could have otherwise saved you either is no longer in existence or never made it to market because of fears of litigation. Food for thought. Dr. Greg Castello, thank you.